We're forever talking about workforce shortages in healthcare, but what if one of the barriers could be really easily overcome with a very simple solution?
So one of the key things is trying to break down those barriers, and one of the suggestions that AMA Queensland has is a digital passport. So this will potentially allow movement of clinicians, and it just gives the ability to mobilise that workforce on short notice, because I can appreciate that currently it takes a lot of time and effort. We can never predict when someone's unwell. So I think it's really important to allow the staff or the workforce to mobilise easily and quickly. I guess getting doctors into our state, isn't it?
If you're loving the conversations we're bringing to life on It Takes Heart, hit the follow or subscribe button.
We care for the land and sea. We care.
From pharmacy to medicine, and now as Australian Medical Association's Queensland President, Dr. Nick Yim's story is one of unexpected pivots, rural advocacy and relentless purpose. Welcome to It Takes Heart, Nick.
Yeah, thanks for having me today.
It's been a pleasure. It's been a long time coming, trying to
Absolutely.
get you, all of us together in a room.
Very busy man.
Can I start with, how would you describe Queensland's healthcare system in one word right now?
Challenged. I think there are great challenges across the health of Queensland, but it's not just Queensland, it is across the whole country. So there are pressures in every element, and I think one of the big pressures that we've been trying to highlight is definitely workforce.
So I guess we've just come out of recent elections. We've got a shift in our own state government. We've come out of federal election, lots of promises during the campaigning. I guess, how will this impact healthcare more broadly?
I think it's great that state and federal government has healthcare on the radar. But one of the key things is government needs to listen to stakeholders that's on the ground, to organisations, listening to the members, consumers, because what we see is often is not what is delivered. And that's a great challenge, because I think one of the things is we do need a sustainable healthcare structure moving forward, and we can't be having workforce discussions or rebate discussions 5 or 10 years down the track, which can be very frustrating for all that's involved.
Yeah, completely. So if we then slow it down for a minute and talk about the AMA. So for people listening, who is the AMA, the Australian Medical Association? Where does the Queensland branch fit in? What's their role and the impact they can have?
The Australian Medical Association, or AMA, we're the peak medical advocacy group for doctors. We advocate for medical students, doctors in training, private specialists, public specialists, general practitioners, and also those nearing retirement as well. But the key thing with the AMA is we do hold the government to account. Obviously, without, I guess, that person holding them to account, we don't know where health policy would go. Because ultimately, we do need to, I guess, protect our patients, our community, and to ensure that we are delivering safe healthcare that is sustainable moving forward.
So why did you then want to be the AMA president?
Interesting.
AMA Queensland
and
president.
How do you become
Yeah.
Everyone asks me that question, right?
You're like, why and how?
Yeah, why, how?
Because I imagine, we do speak to people, and some people really want to be a part of the advocacy piece, and some people want to help the person sitting in front of them, and that's more their passion. So
yeah, I think I
job.
was thrown into it, to be honest.
Really?
Yeah, it's one of those things that
tap on the shoulder. You'd be good.
Yeah, tap on the shoulders. Oh, I'll give it a crack.
Yeah.
But it's the same as how I ended becoming a doctor. I actually never wanted to be a doctor.
Right.
I didn't ever want to be a GP.
Tell us about that. So what were you going to do?
Yeah, so I grew up in Brisbane, obviously did primary school here, and you go through, when you're young, you think, oh, you might be an astronaut, maybe a professional tennis player.
None of those things ever went through my head. Go on, So big dreams.
Yeah,
you were like an astronaut and a professional tennis player, so you were going to be something.
Yeah, maybe.
High performing.
And then I remember vividly telling my mum when I was about 10, say, oh, I'm going to be Prime Minister. I was like, whoa, what's going on there? So all those kind of got wiped out pretty quickly. But my dad was a pharmacist, and it's something where I thought that I'll just end up being a pharmacist and then and take over his stores in Brisbane.
Yeah.
But then due to peer pressure, they said, oh, why don't my friends were sitting the medical entry exam. And I said, sure, why not? You don't have regrets.
Yeah.
So let's sit it. And got a good enough score, and I attended Griffith Uni down at the Gold Coast.
Yeah.
And then you start your journey as being a doctor.
And had
How
you
did you-
worked as a pharmacist?
I did.
Yes, right,
So I
okay.
worked as a pharmacist, so I kind of know the systems pretty well.
Yeah.
But
How
it's
did you feel? Like, if that wasn't really the dream, how did it feel when you actually got started?
In medicine?
Yes.
Yeah.
I think when you're young, you try and grasp things, and I think that's one of the mottos is you take your opportunities, because I think taking opportunities is so important. You just don't know where the path will end up. And it's the same as general practice. I never thought I'll be a GP. Going through med school, going through junior doctor's years, you think, okay, maybe a psychiatrist, an anaesthetist, an endocrinologist.
Again, very different from where you've ended up.
Exactly. And it's the same as the AMA Queensland Presidency. Like, the main reasons why I joined was because of the corporate benefits.
Oh, I love it, honestly speaking.
And then you work out that policy plays such a big role, and you have to be in the tent to change policy. And as you go through policy, you realise that the influence that you can have with stakeholders. And ideas are so important, and I guess that's how I kind of eventually ended up. Do I still know how I ended up here? Probably not.
When you said your journey as a doctor, from Brisbane, and you're based in Hervey Bay now in general practice. So did you locum around? Did you work in regional areas? Like, to come from the city to a more regional area, where did that journey come from?
So I was really fortuitous. When I was in my doctor and training years on the Gold Coast, they had rural rotations. So you can choose where you want to, I guess, try before you buy.
Yeah.
I spent time out at Roma in Tully, North Queensland, so 3 months rotations. Also Biggin, Mitchell. And you do learn about the challenges of regional and rural practice, but then at the same time you realise the medicine is so much more complex and diverse because often you're it.
You're everything, yeah.
And
Which must be very daunting when you're doing those rotations.
absolutely, and as a junior doctor, it can be quite challenging, but you always felt quite supported.
Supported by your peers, by the community.
All the above.
Yeah.
If, as an individual, you reach out to your peers, you pick up that phone, go to conferences, you network, you realise it is actually a pretty small world. You see people from around Australia and say, oh, okay, that's someone who I can reach out to. And at the same time, if you reach out to your community, may go down to the local restaurant, the gym, the local bar.
Yeah.
You can have a yarn with them, and it's quite beneficial because they are really supportive of the doctors that come to that town because they realise that they're quite short.
Yeah, absolutely. And you're a year now into your term. How long's the term as the president?
So the term is 1 year,
1 year.
but you have the opportunity to get re-elected for a second year, and that's the maximum. That's the maximum for AMA
that's
Queensland.
maximum. So have you been re-elected? Are we coming up to that point?
So
Is it an election campaign for you?
Yeah. So as we're doing this podcast, I have been re-elected, which is
Congratulations.
So it gives me an opportunity to continue the advocacy moving forward and to set a good platform to hand over to the next president as well.
So so I was just going to ask, like, in the last year, what are you most proud of? And then what do you want to tackle then this year?
So definitely, without a doubt, the state government's commitment to the payroll tax exemption is a great success for Queensland. At the same time, there has been recent announcements of the GP incentives. So we know that it is a challenging landscape for doctors in training to enter general practice. So this is definitely a welcome change from a state government perspective, because historically general practice is a federal government issue.
Right.
So it's quite warming to see. The other big things is obviously the engagement with state government. We all know that there are challenges across the state, and what we're trying to highlight, and we continue to highlight, is, I guess, the challenges that doctors face. And this is further accentuated in rural Queensland.
Can you maybe talk about some of those challenges? Like, what are the things that you're hearing and seeing, and what are those factors that you're really trying to advocate for?
Yeah. We know, like in Queensland, we've had mass immigration from other states and also from overseas. And at the same time, our population is ageing. And obviously, along with that, increases the rates of chronic disease, complications. And that's unfortunately worse in the regional rural towns. So that means our doctors need to see more patients, they're seeing more complex cases, spend more time. And the cognitive load, so obviously we see the adaptation of changing, bureaucracy. What we're seeing is like paperwork, obviously more notes they must take, different referral pathways. And what we're hearing is that people are being burnt out because they do need supports. We do know that most doctors probably aren't working the long hours that we've seen previously, and they are, looking after themselves, which is great. So I've heard doctors saying, no, I'm not going to work full time, I'm just going to work 0.8. And
what caused that shift? Because that's like a systemic shift where they would work and work, and we hear others going, well, I mean, I'm the only doctor in the community, so I just want to keep going and going.
I think there's many reasons what's led to that systemic shift. At the same time, we are hearing, increased education surrounding mental health, and doctors, healthcare professionals, we're not immune to mental health challenges as well, such as depression, anxiety, stresses. We are working that high-paced, high-stress job, and we are hearing, unfortunately, of colleagues committing suicide. And this is something that we do need to change, that landscape. We also know that doctors who are coming through now, they do cherish the balance of spending times with family, friends, and historically, occupation was an individual's identity. But I think we are seeing more of a balanced picture.
Yeah, absolutely. Across so many different professions, yeah. Oh, sorry, I was going to jump in, but you go.
I was just going to say, so the attrition is a huge issue. How do we, apart from supporting them, what are the key things we need to do to assist with future workforce shortages, or ensure that people are choosing medicine in the first instance, but also from those challenges that you talked about, that people aren't going to be leaving medicine? Because I assume that they're great, that people are catching themselves and there is a bit of a balance happening, but I'm sure that there's still a huge majority where maybe it's not the case, or they don't know where the support is, and they're opting out.
To your point, we don't want to be talking about workforce challenges in another 10 years, right?
Like, that's a big question, what can you do? But what are some of the smaller things that can really have big impact?
Yeah. I guess, how much time do we have today?
You go. Give us your high-level dot points.
Yeah. I think there's... I have a good friend in Hervey Bay when I first arrived at Hervey Bay, and we acknowledged that Hervey Bay, it is a regional town when I first arrived 11 years ago now. And people now are moving into Hervey Bay for many reasons, and one of the reasons is location. So to sell or to maintain doctors in that job or that location, it's not about money anymore, okay? I think people often think, okay, we'll pay someone $1 squillion and they're going to stay. But I don't think that's the case. We've seen this highlighted in many rural areas where, amazingly, government plus local council have been offering great packages,
a lot
of incentives.
Which I guess might get them there, but then they make the money and leave.
Or it might not. They might not be leaving because of the money. I think there's a need for, obviously, you need your location. The area needs to be livable as well, and also the lifestyle. And it's something where I know in Hervey Bay we've been negotiating with local council and stakeholders to go, okay, what are things are needed? We know currently there's a housing crisis. So one of the challenges is if doctors do want to move to a town, if there's no housing available, well, it's going to be quite challenging. At the same time, we need schooling, we need for their kids, for their spouse potentially, a job as well. So it's all intertwined, but I think it's also integration into that community. If they're welcome in that community, if they have things like they can socialise and network, it's not just about food and wine, it's the whole package.
And the packet and the monetary value,
And what are there associations and things in place? So if a GP was going to go to an area like that, and the practice might have certain measures already in place, but what else within the community? You know, if doctors are listening or healthcare professionals who think I want to go somewhere, where do they start? How do they find those connections?
So I can use myself as an example. So when I chose Hervey Bay 11 years ago, I was going up there for training. And I thought I'll just go up there for 2 years and come back down to Brisbane. And I didn't know anyone up there. And I thought, okay, let's join a local touch footy club. Let's meet them. So I remember my touch footy team had a charter boat fisherman, a solicitor, had a teacher, and also a groundsman. Yeah. And it's something where you sit around after the game, you can talk about what's happening in town, maybe have a bit of a beer, and then at the same time you form those connections and you network. And it's something where it's not just about socialising with doctors and healthcare professionals, it's socialising with the community. So that's one thing, it's getting involved in the community. But at the same time is making that effort to reach out a little bit further. Have a conversation with the local barista, have a conversation with the local restaurateur, all those type of things, because you definitely can have those connections. I love it that when I walk down the Esplanade in Hervey Bay, that when I go to my local coffee shop, my long blacks are ready to go.
Yeah,
and
they
it's
see
something
you coming.
that, exactly, those small little connections.
What about burnout? You used to touch on that a little bit earlier. In your professional experience, or actually in your career first, have you ever experienced burnout?
There are periods throughout my career where we felt tired and fatigued. I'm fortuitous that I have a great support network. My lovely partner, she keeps an eye on me. At the same time, I've got 2 lovely dogs, and they're quite great stress relievers when they pat you. But it's something where I've learnt throughout time where I think some of the warning signs for me is like when I go, I'm sleeping a lot more, I'm feeling really tired, maybe getting a little bit snappy or stroppy. I think, okay, I need a couple of days off. Yeah. I do have the luxury, being a general practitioner, being a private practice, I can go, okay, I'm wearing a bit thin, so how about I take a couple of days off 2 weeks in advance. So it's looking out for the warning signs before it goes downhill quickly.
Do you think more... Oh, sorry.
No, you go.
Do you think more broadly across the medical profession that there is support around that? Is there, people leaning in and helping each other, or are we...
And how can leaders
because
better support their teams? What are the signs?
You hear varied things, don't you, from working in a hospital, very different environments across Australia. Are there some pockets where it's more challenging than others, or...
I think definitely we've come a long way. The mentality needs to change a little bit. So obviously historically we think, okay, I'm the only person that can do that job. Okay, I'm sick, I've got a cold, I've got a fever, but I still got to get to work because I'm the only person that can do that job. But I think the wheels are changing, it's turning, and I encourage my juniors to take their sick leave. If they're unwell, I want them to take that day off because I don't want them to bring their cough or cold and spread it to my rest of my nursing team or admin team. And obviously, if you take that early day off, it just means that you'll be back to work earlier and it's going to be less time off work. So I think that culture is changing. And I think it's turning a little bit in the hospital system because historically people think, if I take that day off, it's not going to look good for my CVs, all those things. But that's definitely changed. And I think there is definitely support out there. We've got great organisations such as Doctors Health Queensland, those something who do provide support, which is amazing.
Is you mentioned earlier about the suicide rates in the medical community. Is it largely burnout that's been the main contributor, or are there other pressures that we're not aware of?
It's an interesting question, and this is something where we probably do need data on, and it's not a great topic to talk about. It is challenging, but anecdotally what we're seeing is often because we take so much weight on our shoulders as doctors, any poor outcome or untoward outcome, doctors, we feel guilty about it. And obviously if there aren't supports in place, such as debriefing, mental support, speaking to colleagues, it can be quite a lonely place. So I think it's something where it's really important that we have those networks. And just like any profession, unfortunately, untoward outcomes can occur.
And I think in a smaller community, you often know the person.
Exactly.
I imagine, which adds an extra layer of grief and, and managing.
Yeah. The other big thing is obviously the regulator, APRA. So AMA Queensland, we've been working very hard with the regulator because some of the frustrations that we hear is often the delays in investigations, and it's often can be quite challenging because sometimes doctors may not be able to work or might have restrictions in place until the investigation gets completed.
So the AMA, do you have a lot of impact, APRA at the minute when there's backlogs? Say we've had the expedited specialist pathway come through, there's backlogs. Can you influence that at all, or is it more...
I guess it really depends what the term influence is, right?
Yeah, right, yeah.
Do you work together?
Yeah, we work together. We highlight the challenges, and I always have a theory that transparency is key. We acknowledge that there are going to be budgetary constraints for every department, whether it be the Queensland Government, Queensland Health, APRA, and money is finite. I think it's something where if regulators can be transparent, it's going to be assisted communication to doctors and healthcare professionals.
Going back to those pressures too, I was just thinking... in today's world, there's feedback. If patients are disgruntled, they can jump on, Google reviews, social media reviews.
Say, with the restrictions and allegations you were talking about, like, has there been an increase, or has that always just been a problem, or have you seen a real because of that?
Because people are, they can type. It's not. There was never those forums before, but you see that now. We see them in forums now where they literally name, don't go here, do this.
It's an interesting landscape, isn't it, within the digital world?
Yeah.
We have definitely seen an increase of complaints online.
Yeah.
That may never reach the regulator. Obviously, we also are hearing from the regulator there are increased number of complaints, but many of those complaints never reach the doctor. They just get palmed away, which is really promising. And those are the things that we don't hear. But unfortunately, in this digital world, it's very, very easy for complaints to be made. And it's unfortunately quite difficult for the clinician involved to, I guess, defend that because you'll ultimately be breaching confidentiality and privacy.
Yeah.
That must be a huge component for people. How do we overcome that for people considering medicine? We really want people to choose this as a career. What's the future for that? How do we make sure that people feel comfortable that it's still a very safe and rewarding career moving forward?
Medicine is a great career. It remains safe, but I think there's tweaks around the edges that needs to be made. Medicine now is totally different to medicine 10 years ago, 20 years ago. Likewise, medicine in the future is going to keep evolving. It's going to keep changing. There definitely needs to be government policy changes. Whilst to protect the public, that's really important, but at the same time, there needs to be protections against frivolous complaints. And that's going to be find that right balance is going to be the most difficult thing. Yeah,
I bet. You talked about medicine in the future and technology, and we were talking before we started about ChatGPT, and is this podcast even really happening? It is.
Yeah.
And even if you think you just mentioned there's different from 10 years ago.
Yeah.
Like if you think about the 10 years ago today, and then the 10 years
in the library, pulling out the actual physical book, and now, how is all of the tech advancements, AI? How do you see those impacting the medical profession in the future?
The AI and tech advances, it's already impacting. It's already happening. So we're seeing, scribes. We see dictation. We see those things that's already there. The biggest thing we do need to, be part of it. We do need to set policy to ensure that we are protecting patients to see who's responsible. But we're already seeing, AI is already preliminary reading radiology, x-rays, also looking at skin spots and lumps. There's already algorithms in place. We're already seeing in medical school and universities, they're adapting, they're probably using more videos as opposed to those lecture room style learning. They're using videos, they're probably using more automated type teaching. It's really interesting landscape. Moving forward, it'll be an interesting spot because I think we're moving so quickly. It's hard to predict what's going to happen 5 years down the track.
Is there any roles in healthcare that you see becoming redundant with the advancements of tech and AI?
I don't think there will be roles of healthcare being redundant, because ultimately there still needs to be a decision maker under current legislation and policy.
Yeah.
Someone still needs to be responsible.
Yeah.
There can be maybe improvement of efficiency, so that's going to be definitely really handy because given that workforce challenges, if we can improve scale and efficiency, that can be beneficial.
Yeah.
And I guess the human error component too, it could assist there, do you think?
I think there's elements of reducing human error, but there's something that I don't think machines or AI can predict, is that gut feel that comes with experience.
Yeah.
Okay, that hunch where even though when you do a test where a patient goes, oh, something's not quite right, even though all the tests come back normal, the experienced clinician can go, something's still not quite right. Let's do a further test.
Yeah.
So I don't think technology can do that.
And equally to that interaction piece as well, you know, for if we're just getting results coming back going, well, nothing's wrong, but then to have that person to person, you know, patient to doctor interaction, to see them and think, you know, let's push a little further. You can't replace that either.
Definitely not. And I think you bring up a really good point, is that communication rapport. One thing that's so important, and I know you have many listeners that might be coming into Australia, like, we do know that communication rapport is so relevant, important, and also it's difficult to, I guess, teach. It's something where it's communication. It's one of those things with body language. It's tricky.
Yeah, and it's also learned, like you said, with experience, you know. So from where you were a junior doctor to right now, like picking up on those cues, and maybe that's where the AI, the research, that you might fast track some, but you've still got to learn those human skills, which might mean a completely different degree. So, you know, like if you think about the skills we need to hone in on.
Well, definitely. And do you think with the advancements, there's going to be new roles that we currently don't have, new careers on offer in health?
I think that's already here. We've already got, I guess, people in healthcare, in medicine. They're moving into, say, digital advancements, AI technology, maybe app development. Those things are already here, and I think it's going to keep moving forward. Like, I'm sure there's going to be an increase in robotics, for example. We're already seeing in orthopedics and a lot of surgical specialties using the use of robotics, but more as an aid. But there may be a time when maybe the robot will be doing the whole surgery.
Yeah. Wow.
You would never sign up for that surgery. I could just see you would be like, no.
So are there any other initiatives with the AMA that you're really focused on this coming year?
With the upcoming Queensland state budget, one of the big things that we're working on is definitely workforce. But one of the other priorities is, I guess, the ability to streamline the movement of the workforce across Queensland. What we're hearing from doctors, people who want to work in Queensland and also around Queensland is the challenges of credentialing. And for those of you who are listening, what credentialing is essentially completing all the paperwork that's needed to work in each health service.
And that paperwork is different in every region.
Yeah, and that's one of the barriers. So one of the key things is trying to break down those barriers, and one of the suggestions that AMA Queensland has is a digital passport. So this will potentially allow movement of clinicians. So for example, someone is working on the Gold Coast and maybe later on in a month's time they want to work, say, at Rockhampton or Mackay.
Or they even, in some cases, it's that they're just on their holiday. They might want to do a short period of locuming.
Exactly. And it just gives the ability to mobilise that workforce on short notice, because I can appreciate that currently it takes a lot of time and effort to get all your degree certificate, your immunisations, your references. So it's something where across the state of Queensland, we are one state. It's something where it'll be great if we can see a digital passport in place.
It's so true when you think about, you know, burnout, we talk about, even in these regional areas where if a doctor needs a break, it might just be a week. Like there is a workforce here that if we could get them to go out and do a week, like the impact that could have for that doctor's well-being, for the community. But if it feels too hard to get credentialed, they're not going to want to do it.
Absolutely. And I know, and you know, like if it's one additional step or two additional steps, is that people go, I won't head up there. And at the same time, for the locum workforce, many of this workforce is on short notice. We can never predict when someone's unwell. At the same time, it could be a family member that's unwell, At the same time, there might be conferences people might need to get out to, and also, as you mentioned, is to prevent that burnout. I think it's really important to allow the staff or the workforce to mobilise easily and quickly.
What can we do to get behind that digital passport? How do we make that happen?
Can we help?
That would
Yeah,
help.
I think it'll be amazing, and I guess it's keep mentioning it. It's something where if we can have people continue to lobby for a digital passport, and it's a relatively low investment. It's something where if we think about the time that's needed.
Yeah, what's needed to actually
Yeah.
implement it?
Yeah, obviously I don't have the full numbers,
Yeah,
but
yeah.
if I think about we think about time costs, administration costs, staffing costs, I'm sure it would probably be, as a bare minimum, it'd be neutral, if not positive.
I was going to say probably have more of a positive impact. You think about all of the credentialing that's done at every single individual region. It could just be so much easier, and we could focus on other issues.
Absolutely, and it's, I guess, getting doctors into our state, isn't it?
Yeah, 100%.
Absolutely. So you talked about what's needed in some of the rural areas to really make sure that people, they come but they stay. What do you think more broadly? How can we attract doctors to the medical field?
Really tricky question. So
Because it used to, just before you say that, because it used to be, I know, well, I'm probably showing my age now, but I know we went through it with such a prestigious
Yes.
career. It was like you were going to go be a doctor, or a lawyer, and then it kind of like went down the list. But there's so many new careers coming out now, and also you can have multiple careers, So you had, how do you cut
Medicine,
through
but then
that?
also into general practice as well.
I think medicine is still a very attractive career for many people. So for people in high school studying in undergrad who want to enter medicine, definitely taken to arms. The variety in medicine, I think that's something to highlight. It's not just clinical roles now. There are many non-clinical roles where a medical degree can take you. So that's where the attraction. Definitely, we're probably in a generation where you've just highlighted that it's not just one career anymore. Gone are the days, I suspect, people will just do medicine and do one job. They're going to diversify. They might go into maybe medico-politics. They might go into advocacy. They might go into research. The world's an oyster. There's so many things that it is available on option. There is still that, I guess, the respect, the knowledge available, but we're also competing against Google,
Yeah.
the internet technology, and that's where we need to adapt. And I think the thing that we can adapt is communication. If we can adapt our communication and explain, okay, the reason why it's not X, Y, Z, Google can't do that.
Yeah, absolutely. The AMA then, what support do they need? For you to do your job well, from your members, from the community, what can we do to help you?
So the Australian Medical Association, AMA, we are a membership organisation. There's often a saying that obviously whilst only some of the clinicians are paying members, the advocacy work that we do benefits all doctors. So it's something where we do need members to tell us what are the pressure points, where can we change policy, so we can advocate for you, for the doctors, because ultimately if we can ensure that doctors are well represented, they can deliver better care for their patients, and that will in turn ensure a healthier Queensland.
Yeah, 100%.
And maybe if there are doctors out there thinking, do you know what, I'm really passionate about this work and maybe I could do this in the future and put my hand up at AMA, what advice would you give them?
Definitely put your hand up. It's something where knowing the stakeholders in the room, knowing where the pressure points are, and then we know that policy change doesn't occur overnight. It can take months to years. It might take a couple terms of government, but knowing how we can strategise, how we can adapt and change the policies, that's crucial there. But definitely put your hand up, give me a call.
Fantastic.
Yeah. So I guess with this episode, CMR are donating, making a donation to a charity of your choice. Can you talk to us about where that is today?
Yeah, so I would like to make that donation to the AMA Queensland Foundation. So the AMA Queensland Foundation, it's a charity that assists doctors, many groups as well. So to give you an idea, sometimes the current scholarships are for the medical students are facing challenges. So they may be personal, financial challenges, And it's really beneficial because some people, we know that without some of those scholarships, they couldn't continue their studies. And we know that we need to continue those doctors in our workforce.
Yeah,
Excellent.
Thank you for your time today, Nick. I've got to ask one thing that didn't get. You said you wanted to be an astronaut and then a professional tennis player. Did I hear that you were a professional umpire at one point or something?
I was, actually, so good research.
Tell us, just before we close out, one moment there. We've missed something there.
Yeah, so I had a great opportunity. So when I was quite a high state-ranked tennis player when in my teenage years, and there was an opportunity to go do some umpiring.
Yeah.
So you go through the local tournaments, and around the age of 16, I ended up at the Australian Open down in Melbourne. So that was
umpiring.
What an opportunity.
Umpiring.
Did you umpire anyone that we would have heard of?
Oh, absolutely.
Yeah.
So I actually umpired 6 consecutive finals on Rod Laver Arena.
Oh, my goodness.
So Agassi, Roddick, Federer,
Wow.
Leighton Hewitt, the Williams sisters.
Oh, my goodness. So, I mean, really, like, you could be Prime Minister. I mean, if it was like I was going to be professional.
It's a tough gig.
I mean, this is a stepping stone, right? I feel like we're going to be talking to you in a few years going, can you come and talk to us, Mr. Prime Minister?
No, I think I might give that one a pass.
What is the future for Dr. Nick Yim?
I'd say it's uncertain. I think live each day as it comes. The opportunities, I think I've learned you do take them. It's something where there's never any certainties. But at the same time, I have worked out that self-care is pretty important as well. So when I have the opportunities to take those short little breaks, whether it be half a day, full day, I try and get out in the water, do a bit of fishing, try and get across the Gari, the beautiful, previously known as Fraser Islands, great large sand island. So it's, I don't know what the future holds, and I don't think you want to grasp too hard on it because you can tell that paths always change.
Yeah, that's so true.
I think that taking opportunity is really a theme of a lot of people we speak to.
It sure is. Thank you, Nick. Thank you so much for your time. And thank you for all the work that you've done for AMA Queensland. It's been so great to be able to sit down with you today and spend some time. And we're excited to see what the next year ahead holds there for you.
Perfect.
Thank you.
Thanks for having me.
Thanks so much.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.